the most powerful energy in the universe is actually love energy. To acknowledge myself first, to say that I'm okay, I love myself unconditionally. Including everything that is wrong with me, I still love myself. Because that's all I have. I have to love myself.
Welcome to Confident Growth, the podcast for people who are passionate about personal growth and productivity. I'm so thrilled today to have a close family friend, Dr. Hira Singh, an integrative medicine expert practitioner from Perth, Australia, who has been in the field of healthcare for more than 50 years. Welcome, Hira.
Thank you, Crystal. Thank you for having me.
Yes, I must say that during this podcast, you will hear me say Uncle Hira because that is how I think of you, Uncle Hira, family friend. And before we get into it, I will say that I hope this doesn't sound like cultural appropriation or something, but I want to share with you a personal anecdote. When I was really, really young and I grew up, I always thought my father was a Singh. Because I always heard you guys call him Tony Singh.
Yes.
So I thought that was his name.
Yes.
How did this come about?
Yeah, because he was such a part of our close-knit family, almost family group, you see. We were friends, but we were almost family because we used to go to each other's house, celebrate each other's festivals, and did a lot of stuff together. So we actually used... The colloquial word for Singhs when we talk to each other is Sian. So we used to call him Tony Sian. That's what you heard.
Yes, absolutely. I grew up with many happy memories of yourself and Uncle Suresh, Uncle Onker, Auntie Anita, all of that. So it was really quite unusual that my father had very, very few Chinese friends.
Yes.
And the whole circle was Indians. Yeah,
but I also remember you coming to Kalgoorlie to visit me with you and Daryl and your mom and dad.
Yes, that's right, in Perth. That was actually the first time I'd ever sat on an airplane was to go to Perth to see you.
That's right,
Yeah, wonderful. So I'm thrilled to have you here today because you've just come out with a new book, Healing the Whole Person, an introduction to integrative medicine. You are an RI boy. Yes. You graduated from Raffles just as I did in when?
That was a long time ago, in the 1964, I think. 64, 65.
Okay. Yes. Take us through very quickly your amazing career journey from graduation, how you became medical doctor, and then you decided that you wanted to go to Perth and suddenly pivot into integrative medicine.
Yeah, see, after I had finished my national service here, graduated from the University of Singapore, of course, in the medical faculty, then I had a sort of an idea in my mind that I wanted to be a country GP. I didn't want to do this kind of style of general practice which was going on here because I had a little stint of 6 months of working in a corporate general practice in Jurong, and I saw that it's not really what I wanted to do.
Right.
So I migrated to Australia and landed a job in a gold mining town called Kalgoorlie, which is where you visited us. And I stayed there for 10 years, having gone there for 10 weeks. And so there I was able to practice whatever I wanted to do because it was like a country town where the GP does everything. It's called cradle to grave.
Wow.
So you deliver babies, you look after all your patients, all the age groups, and then you put them in hospital. You still look after them in hospital. You do minor surgery, and you look after your patients in the nursing home. You do the whole range of everything. It's not much of a backup there.
How many people were living in Kalgoorlie?
At that time, probably about 25,000.
25,000.
About 5 of us, 5 doctors there.
5 doctors for 25,000 people.
So, but we were doing everything we were running the hospital casualty emergency department on a roster basis. So it was a very, very busy practice. And I was also doing my fellowship training so I got the fellowship of the Royal Australian College of GPs while I was there. And after a few years, I realized that I was pretty good at making a diagnosis. I could treat my patients, manage their diabetes and their hypertension and their osteoarthritis and their depression and anxieties. But I wasn't really making much of a difference in their health. And I was supposed to be a health practitioner, but what I had become was actually a disease manager. Really, then when this thought struck struck me, the contrast was, oh, well, why am I doing this? I'm supposed to be a health practitioner. A doctor is called a health practitioner. And by the way, the word doctor comes from the word docere, from the Latin again, which means to teach. A doctor is actually supposed to teach people about health.
Wow.
And I wasn't doing that. So and then I started to explore the history of our Western medicine, and ended up in looking at these guys in early Greece around 500, 600 BC, like Pythagoras and Alcmaeon, and Hippocrates, who is called the father of modern medicine. And Hippocrates' practice was based on observation of his patients' lifestyle, what they ate, what they thought, what they were doing in their occupation, what was the environment, and he studied the effect of seasons on the different presentations of illnesses.
Sounds like
He
DCM.
said it is more important for the practitioner, the doctor, the physician, to know what kind of a person has a disease rather than what kind of disease the person has.
Yeah.
And I was doing the exact opposite. I was doing the disease part. I wasn't looking at the person at all. So this was a big realization for me. Then I looked at traditional Chinese medicine, and I came across this concept of the qi, this vital energy which is flowing through, and they had mapped out these pathways which they call meridians.
Yes.
And along the meridians there are points they had located called acupuncture points. And by needling these points or applying heat to them with the herb, the moxa, which we burn on the points, they could influence the flow of this energy. And there was an organ which was deficient in energy, we could send more energy there. If an organ had too much energy, we could reduce it. So this yin-yang polarity was also talking about a state of balance. So I went and studied acupuncture with a professor from Beijing University who came to Brisbane, and I started using acupuncture in my practice, and I found it very effective for pain relief, for osteoarthritis pain, because the patient had upset stomach. They couldn't take the drugs that were prescribed for the arthritis, whereas with regular acupuncture I could keep them relatively pain-free. And I also looked at Ayurvedic medicine and realized that these guys were talking about constitutional types called doshas.
Yes.
And they classified their patients according to their constitutional types, and then prescribe specific diets and massage therapies and all that, depending on what the constitution of the patient was. So then I went and studied osteopathic spinal manipulation, because I realized that a lot of these back and neck pains were caused by subluxations of the facet joints, and I could learn to manipulate the spine and reduce them. I don't have to put them on strong painkillers, and get people back, on track much faster. Then I studied the stress management, and I went to the United States and studied biofeedback. Now, biofeedback was at the cutting edge of mind-body medicine at the time. In 1986, I went to the States. And basically we were teaching people how to take control of their autonomic nervous system, which was thought to be beyond voluntary control. Then did some training in meditation, mindfulness techniques and all that. So that's when I came back to Australia. I decided to set up my own holistic medical practice, and I had to move to Perth to do that, because the demographic was more suited to the kind of style of medicine that I was going to do.
Yes.
So I set up my practice, and I declared from the outset that this is what I'm going to do, and it is it's a joint thing. And word of mouth got around, and people started to come, and then the practice grew from there until to the point where it was too busy. I had patients coming from the top of the state in the north, from Broome, down to the southern tip in Albany, all coming up to see me. At a point arrived after a few years where I had to close my books because I couldn't handle the amount of people who were coming in.
That's amazing.
And that's what I've been doing for the last 35, 40 years, practicing that style of medicine until I just retired about 2 years ago.
Ah, that's amazing.
Yeah.
It sounds as if like I always say I have an army of people helping to look after me, which include TCM, Ayurvedic doctor. I have so many, I have naturopaths, I have all this, but it sounds as if you have everything in one.
Yeah, that was the benefit, that I could offer different people different parts of my skills.
Yes.
I didn't use everything with everyone. So
because sometimes it contradicts,
that's right. sometimes, you have to be careful what you offer. Also, the patient has to be receptive.
Yes.
Some people were not really keen on the needles with the acupuncture.
Yes.
And the moxa created a big, strong smell in the room and all that kind of stuff. But just having the choice of not reaching for a drug, which is the only training that Western medicine creates in the doctors, is surgery or pharmaceutical drugs.
Yes.
So they are limited in what they can do to help you. So it's not their fault. It's just that if they don't have a training in nutritional medicine, for example,
Yes.
how can he talk to you about nutritional medicine? Whereas nutritional medicine is the foundation of the health of the body. The body only needs energy from food, water and air. Only three things that it needs. It needs to rest. So if you educate the patient on these four essentials, on what is good to eat, what is not good to eat, how to get an exercise program going, and then how to learn how to breathe properly, because not many people are breathing properly for a start.
So true.
Yeah, and then to make sure you have rest and then manage their stress levels. You can improve their health. Very, very simple kind of suggestions, which are not that hard to implement. And we don't judge people with how much you expect them to do. You say, just try your best. Just do whatever you can. And as you said early on, that when you start something and it makes you feel better,
Yes.
you will start to do it more, right? And it will extend into other areas of your life.
I'm really curious to understand about this whole person model of care.
Yeah, okay. It's just acknowledgement, really, about the different dimensions of influences, important aspects of what it means to be human, that we as humans are more than the physical body.
Yes.
We have a mind, we have feelings, emotions, and we also have some connection with some creative energy, which we refer to as the spiritual.
Yes.
So all of these dimensions of the human impact upon health. And so if you want to talk about health, you can't just talk about the physical, which is what scientific medicine is very good at doing, which is to be acknowledged, because scientific medicine has really created a lot of knowledge about how the physical body works. And it's the physiology, the biochemistry, the anatomy. These are very important foundations for understanding the physical body. But scientific medicine hasn't had the tools to look more into the mind and into the emotions, because these are aspects of our health which are not quantifiable.
Yes.
Right? So we know that the physical level, as we said earlier, that the body just needs good food, clean air to breathe, and clean water to drink, and needs to rest and needs to move. Right? So most people know about good nutrition. It's out there now. There's so much information that we should reduce inflammatory foods, for example, which are ultra-processed foods, and processed meats, for example. So we should eat more well-balanced diet with fruits and vegetables and grains, and maybe a little bit of animal protein, which is white meat preferred to red meat, and hydration, which is 6 to 8 glasses of water, and then to learn how to breathe the body, and we can teach our patients diaphragmatic breathing, abdominal breathing, which you call your yoga breathing, and then educate them about how to switch off so that the mind system can rejuvenate itself during restful sleep. So the body is not very hard. It doesn't take us much to help a person to make changes at the physical level. Then we come to the emotional level, and we acknowledge that fear is the chief of all the negative emotions, and we all have experienced fear.
For sure.
The fear of death, fear of illness, fear of losing our loved ones, fear of financial disasters, fear of the future, fear of what people think of us, fear of what may happen to our children. There are so many fears, and these fears motivate our behavior. We tend to be a bit on red alert most of the time because of danger. Something may go wrong. And it's fair enough when there is danger that we should protect ourselves from danger, but sometimes after the danger is past, we are still left holding on to our red alert state, because we don't know when the next attack is going to come from life. So this creates you are contracting your life energy, you're not connecting anymore.
For sure.
And this is not a very good thing, because this contraction of life energy based on fear will then express itself into all kind of negative emotions, chief of which is anger. And anger is a normal response to a desire which is not fulfilled. And that's okay to feel anger, but we are brought up as good boys and girls, told not to get angry. So anger is usually suppressed. And when you suppress the anger, then it will turn into rage, resentment, blame, jealousy, frustration, helplessness, ending up in depression. And this has now been shown by Professor Candace Pert in her book, The Molecules of Emotion, that there are actually neurotransmitters being secreted in response to these emotions. And these neurotransmitters like stress hormones like cortisol and adrenaline then jam up your immune system, your endocrine system, and you actually have physiological setup for illness. And equally, when we encourage people to practice positive emotions like love and compassion and empathy and sharing and giving, and we are producing very positive kind of chemical changes in the body through the oxytocin and the dopamine, these hormones, which are feel-good hormones.
Yes.
And that feel-good, it's actually a physiological reaction takes place where the system is relaxed and the parasympathetic nervous system comes in, and you feel a sense of ease. You know, in your life, your life energy starts to flow, and you start to flow through your life. So you are now connecting rather than contracting. And that's where love comes in, and love is the chief healing emotion. The most powerful energy in the universe is actually love energy. To acknowledge myself first, to say that I'm okay, I love myself. That means I love myself unconditionally, including everything that is wrong with me. I still love myself because that's all I have. I have to love myself. So this is all the emotional work that we do. We do a bit of emotional processing work with our patients along these lines.
Wow.
Help them to recognize where these things are happening, and then help them to shift. Then comes the mind. The mind is the most powerful energy at the mental level. Our thoughts are actually energy. And the kind of energy that you decide to hold, whether it's positive or negative, will have, of course, an influence on your physical health.
Yes.
So positive attitude is what we encourage, but you have to be careful that when we talk to our patients about positive attitude, we don't just mean that, wishful,
Toxic
fanciful
positivity.
kind of thing. No, it's a serious acknowledgement of resilience within yourself, that whatever the suffering I'm facing, I have the capacity within my system. I have an intelligence operating here which knows how to promote healing, and I just have to understand and work with that energy. So the positive mental attitude actually involves trust. We have to trust and surrender to the process of what is happening to me, because it is real. No point saying, I wish this was not happening to me, why is this happening to me, this is unfair, this, that. Waste of time. It is real, it is happening. You might as well say yes to it first.
Yes.
The moment you say yes, possibilities start to open up. You are starting to connect with life again, and your trust starts to come back, because trust is betrayed along the way as we are growing up. People can betray your trust. You can even lose trust in your own capacity.
You can betray yourself.
That's right, exactly. With your self-doubt, you can be betraying yourself.
For sure.
So to restore trust in the patient and help them to connect with life energy in a bigger sense, that is the first step towards movement, towards health.
Yes.
So that mental attitude, then with the mental chapter in the book, I also talk about meditation and how powerful it is, because we have more than enough evidence. We have 4,000 over published articles about the benefits of meditation, how powerful it is. It's actually a physiological response of relaxing the system. With relaxation, healing can take place. So this is a no-brainer as far as I'm concerned. But when we were talking about meditation 40 years ago, it was looked upon as some kind of mumbo-jumbo stuff. And now we have evidence from scientific studies to show how beneficial it is.
Yes.
So then the spiritual is basically a kind of a grounding, a connection with some bigger sense of self. Doesn't matter what you call it. Some people will call it God, some will call it creative energy, some will call it the divine. I'm not really stuck on any of these words. I tend to use whichever word the patient is comfortable with. And say, okay, think of your identity as something bigger than this ego persona that you have. I have a name, I have a sex, I have a gender, I have a role, I have an occupation. All these are labels that we wear and we play these roles.
Yes.
But your identity is in something else. The truth is bigger than what we are actually identifying with.
Yes.
So if you start to not identify exclusively with the physical body, when the physical body gets into trouble, you can say that, yeah, my leg hurts, but I am fine because I am not my leg.
Yes.
I own my leg. The leg belongs to my body belongs to me. Who is this me? So this me is above any of this stuff. So you can say, my liver has cancer, but I am fine. So when you shift the identity, then it makes the transition when it comes towards the end of our physical incarnation, when we have to go through in the body, it will be a little bit easier rather than being dragged by the hair, complaining, I don't want to go, I don't want to go, I'm so frightened. Because you realize that it's okay, it's all right, because who I am is not this thing that is about to, go through a transition of dissolution.
Yes, it reminds me of like what I think Pema Chodron said. It's like you are the sky.
Yeah.
You are the sky, and all of these are clouds. And
that's
if
your
we
thoughts.
can observe ourselves, then we know that if I can observe my liver and if I can observe myself, then I am not this. I am the
That's
observer.
right. You have to be something else.
Yes.
Because the language we use is my body. So who is this person who is saying that it is my body? There has to be some.
Yes.
Yeah. That's a good way of describing it, the sky and the thoughts, yeah. So then after the spiritual comes the environmental, because we have to acknowledge that the physical environment has an impact on our health. So the clean air and this clean water kind of thing comes in, sanitation comes in. And then we talk about the biological environment, the sociological environment, we talked about earlier, that study. And we talked about healthy aging, how to respect the wisdom of the elders. So when we put this whole program together of the physical, mental, emotional, spiritual, environmental, we create an understanding in the patient of their bigger sense of self and how they can start to take responsibility, start making changes in each one of these levels, small changes, and they will add up and you will experience better health than what you have now.
That's
because
so
the
important.
illness was just a crisis to alert you. And you respond to the message. You don't just shoot the messenger. You listen to the message and make some changes.
Yes.
Yeah.
Somebody once described to me that Western medicine is kind of like, you have a car, the instrument panel is telling you something, but then you go and get some duct tape and you stick it over the, instrument panel. It's like, okay, so this is no longer making alarms and whatever, but the fundamental problem still hasn't gone away.
That's right.
Yeah.
It's the same as this. Somebody gave this an analogy of the fire alarm.
Yes.
When a fire alarm sounds, you don't just go and switch off the fire alarm. You've got to go and look for where the smoke is coming from, right? Then you go and switch that off. Then you go and attend to the smoke where it is coming from, which is the cause of illness, rather than just the symptom, the message coming through.
For sure. So tell me about what are your objectives for this book? What did you want to achieve with this?
You see, when I was about to retire, my patients said, look, what are we going to do? Can you write down all this stuff that you've been telling us all these years?
Yes.
So that we got some kind of a way to refer back to these things they used to tell us. The idea was to help people with some information that was easily accessible and they could apply to them for themselves. So take some responsibility for your own self-care. This system that encourages you to live an unhealthy lifestyle and say, we will fix you up, don't worry, that is all wrong. That it cannot be done because, as you know, tertiary care is cannot be supported exponentially. The cost of fixing things up after they have gone wrong, we could have prevented all this trouble so much at less cost by just educating our people about preventive health habits. And this is a small little attempt to educate people on what they could do to look after themselves.
Right. Yeah. I found this book really easy to read and like so practical, but I really was curious also about the chapter on epigenetics. I think this is something that I've been quite interested in recently, and I wonder whether you could take us through a little bit about like your views on epigenetic and explain to the layperson what is epigenetics, why is it so important?
You see, epi means above. Genetics is our gene blueprint. So we have a blueprint, which is our genetic makeup. So epigenetics is that above the genetic makeup, there are other influences. These influences are your lifestyle, your behavior, your belief systems and stuff like that. And these influences from above are actually influencing the expression of your genes. So you're not, it's not a death sentence kind of a thing. It's not cast in stone that because you have the gene for cancer, for example, that you will get cancer. You have to switch that gene on, and the switching on and off of the genes is from this belief system and your lifestyle. So now they have shown that a healthy lifestyle, even though somebody is carrying a potentially gene for some serious illness, it doesn't have to manifest.
Right.
And they are done these studies with twins, they're carrying the same genetic makeup, and one of them will get something and the other will not, because they are living totally different lifestyles, different belief systems.
Yes.
So this is a very new kind of knowledge that is now being put out, which is very encouraging to give to people, to say that you don't be so afraid of life. Live a good, clean, honest, healthy kind of lifestyle, and don't have to worry so much about your genes. They doesn't necessarily mean that you have a gene means you will get the disease.
So what do you think about DNA tests and all of that?
So this
then?
DNA testing, genome, because we have the blueprint for the human genome now, there is a again, this is based on our insecurity as human beings. We want to know life. And you go and map up your genome, and you might find there potentially you may get this, you may get that, and it can create some problems for people if that profile is not explained to them properly by a trained person in genetics, because there are geneticists who are specialists who will interpret for you your gene profile. But a lot of the commercial kind of a thing that is gone on with genome testing is fraught with a risk, and I think it could be dangerous for some people who do not have the resilience or understanding about how genes express themselves. They may believe that I've got this gene, I'm going to get this thing.
Yes.
And that is not a very clever thing to do. So
some celebrities have even gone so far as to identify they have certain invasive genes for breast cancer or something like that, and then have preventative double mastectomy. So what do you think about that?
No, that is the BRCA1 and the BRCA2 genes. Those have got expression potential if there is a very strong maternal family history. And if you're carrying that gene, then you have to analyze that gene. There are variations of it. If you have a slight variation of it, you may not get into trouble. But if you have a certain variation of it, which puts you in very high probability of getting it, then it is advised that you go and have prophylactic mastectomy, because the chances are almost 90% or something that you will get it.
Wow.
So those genes are not the ones that people are looking at with their genomes profile. They're looking at all kind of funny things like, will I get dementia and this kind of thing. Dementia is not a genetic thing. You may have the genes, you may have a family history, but you will not get it if you live a healthy lifestyle.
Got it. Once I heard this analogy that we're all born with a gun pointing to our head, and in the chamber there are 6 bullets, and the bullets might be different, might be stomach cancer, might be Alzheimer's, might be all of that. But what actually pulls the trigger is stress.
Yeah, stress.
And if you're not, stressed, at least this is how it's explained to me, you could have all the bullets in the gun, but nothing gets fired.
Correct. That's a good way of explaining to people. That's a good way. So it is true, what you're saying is absolutely true. It is in the end our belief systems and our lifestyle, our mental attitude, our emotional makeup, our relationships, which decides the quality of your life, really, whether you get sick or you stay healthy. But in the end, the body will have to find an excuse to exit. So that is okay. As long as, earlier on in the piece, you said about growing old gracefully and being able to function right up to the end, that should be what is called healthy aging. We should aim for that. Yes.
Yes. What other advice do you think it's relevant for people who in Singapore, our audience is normally busy working professionals. Everyone is time poor. Everyone is stressed. Everyone is trying to pay their mortgage, trying to take care of their elderly parents as well as their young kids. Like, what kind of advice do you have for them?
You have to create some sense of priorities, and you need to have some priorities. I mean, a younger person has priorities for accumulating, wealth, for example, or accumulating experience through training and study and stuff like that. So that's their focus. Then later on in life, you get settled down, you're into a relationship, you have children, your responsibilities change again. And then after the kids grow up and you've got a bit more free time, then you have different priorities, right? So for each of these age groups, the priorities have to be managed in terms of what is really important. And if we can tell or educate our people to realize that health is actually most important. If you don't have health, you will not be able to achieve all these aims that you have set up for yourself to become whatever you want to become, or you want to get rich or whatever, you travel and all that. So you focus on some simple health habits and we educate them about good physical, what we talked about earlier, nutrition and exercise and rest and sleep and all that, movement. You got to build this thing into your day somehow, whether you go to a gym or whether you do it at home or you sit down for 15 minutes in the morning before you go to work. It's not hard. When you drive to work, you can just sit in your car for 5 minutes before getting out and just relax your breathing before you get out of the car. These are simple things. During the day, you can do minor, what I call in the book is mentioned, these are called coming to your senses. That means, because as you know, our mind is always running around. Either is thinking about what I should have done yesterday and I should have said this to so and so, and then he's dreaming about the future. Or tomorrow I got to go and do this. I got to get this ready. But the present moment is our only reality, and unless you can change do something different in the present moment, your life is going to be the same every day, right? That's what the Buddha said. I think if you don't change the way you are living your today, then your tomorrow will be the same as your yesterday. So you have to do something. So coming back to what people can do, people can prioritize, set aside 10-15 minutes a day to become quiet, engage in loving relationships, be conscious of the thoughts that they're holding in their mind, and be conscious of the feelings that you're holding in terms of negative and positive feelings. And that, if you keep things simple like that, if you educate our people, it's not that hard. Most people will get the message that it's better to prevent illness, better to remain healthy, and I can do something to keep myself healthy. I can still go and do all my roles that I have to play. Of course, nobody is telling us you shouldn't go and withdraw into the cave or anything. No, you live in the society. You must be participating in society as a contributor. Yes, you have to work. You have to raise your family. You have to provide for shelter and everything. You do everything. But you do it with a slightly different attitude, not out of fear, not out of missing out, this fear of missing out kind of thing. And this social media, the pressure that our young people have. This my concern is that the younger people living virtually in a digital world are not getting the skill training in how to relate to other human beings.
Absolutely.
And this is not foreboding well for the future of any society if we don't know how to socially interact in a healthy way with the people that we live with. And that's the important thing to point out to them.
What I'm hearing from you is that, we have to make time for coming home to ourselves.
Exactly, yes.
And sometimes in this busy modern life, we can lose ourselves in all of these expectations of us, but then you're no good to anyone if you don't actually have that self-knowledge and that just 5-10 minutes, 15 minutes a day, come back to yourself and connect, because it's the world inside as well as the world outside that matters.
That's very well put. That's a simple message. And I think that will go down well but more and more influential people need to be talking like that. And if if you can influence a small group and they influence the next, their friends, that grows the momentum, the potential for educating our people is very high.
I'm so glad to be speaking to you because like our community is so passionate about all of this. Like we have a Deep Human Club here in this office where we have 150 members and we get together every week. We meditate, we do expressive work, we do group processing, group check-ins, we do all of this, and we have guest experts, speak on topics. We'd love to have you come sometime to talk next time you're in town perhaps. But it is so important because I feel that like you are a pioneer talking about this. Like I feel like in this world I'm still regarded as something of an oddity, like talking about all this stuff, but I can't even imagine what it must be like for you who did this like 40 years ago.
That's right. Yeah, it was not widely accepted at that time, but there were enough people who were educated enough, who were affluent enough, who were starting to think about self-care and had enough of side effects of drugs and were not entirely happy with the system which they had for their healthcare. And so I was basically preaching to the converted in some ways. It didn't take long to convince those set of people. But then that cohort with their children in turn taking on from the parents grew from there. And at the same time, we were getting more and more scientific studies to validate how important lifestyle was. And so it became more and more mainstream. And then with digital media and social media, the message has gone out everywhere now. The antithesis to that is that we have too much knowledge on our internet media now. That it's very hard to know why is somebody saying this, and then somebody says the opposite, and both of them sound very true, and it becomes difficult to discern sometimes the message coming through on social media.
I agree.
And
totally.
it's sometimes quite extreme suggestions which people are putting out for not for good reasons, but for whatever personal gain. They want to sell something and stuff like that.
Sometimes it can get a little depressing or scary to read all of this stuff, and I wonder, like, what is the balance of knowledge and actually knowing
That's
too
why
much?
You need somebody that you can trust. Really, or at least someone who is knowledgeable in these matters. So it's important to question when you hear a message on the media, who is this person, where did they come from, what's their background, who is sponsoring them, what is the deal here. And you need to exercise some discrimination to pick up knowledge. Like these microplastics you mentioned, they are they have gone into our air we breathe in, is in our water, is in our food, is in everything. So we have to practice some discernment, that we try to aim for fresh fruits and vegetables, don't buy ultra-processed stuff, You can do something yourself, but at a certain level it is unavoidable because we have polluted the earth's environment. The air we breathe, the water we drink, the food we eat is all contaminated to some extent, right? So you can only do your best to steer clear as much as you can. And to get too frightened about it is also not very helpful.
It's a
you got to live your life, and sometimes you look at the social media and they tell you got to do this, you got to do that. If you did all that stuff, you had no time for anything else in your world.
I totally agree.
You got to eat this food, you got to do your tongue exercises.
You got to soak your nuts, you got to sprout yours, you got to do all this.
It's impossible to live a life. Life is to be lived, and it is to be lived with a certain amount of abandon, and you have to trust in life and say that I'm not taking crazy kind of risks, but I'm basically trying my best, and I'm doing all right. I think that's the message we need to reassure our people. You don't get too stressed about all this stuff out there.
So one last question. I want to understand your morning routine because I've interviewed so many people about their morning routines, but I have a suspicion that yours would be one of the most valuable ones because of your wisdom and experience.
We got to qualify that to say that it doesn't apply to everyone, right? For most of my adult life, I have practiced a discipline. I get up around 7 o'clock in the morning. And I will then do some yoga style stretching exercises, sun salute, and a few other kind of stretching exercises
Yes.
for about 20 minutes. And then I will sit in meditation for half an hour to 45 minutes most days. And in my physical stretching, I also incorporate a bit of light weights kind of thing to keep the muscles and bones going. So a bit of weight training, resistance training, you call it, yeah. So I use light weights to do a bit of weight training. So then that's in the morning. Then you get up and go to work or whatever, and then.
Do you take any supplements in the morning, or what do you take for breakfast?
I take some supplements. I take some fish oil. I take some vitamin D because of my skin color. I don't get much. The sun doesn't penetrate as much, and I think those are the main supplements I take. I don't take too many supplements as such.
Okay. What do you normally eat for breakfast, or do you eat breakfast?
I have a fruit for breakfast, either a banana or an apple or a pear, and then I have a mixture of nuts and seeds, which is my breakfast, with a cup of green tea.
Oh, okay.
Yeah, that's my breakfast. Then lunch, I usually have a salad or something simple like a tin of tuna with a couple of rice cakes or something like that.
My Ayurvedic medicine practitioner told me that I should stop eating salads. He says it's bad because of my Agni is not high enough. My digestive fire.
It's not high enough.
Yeah, I mean, in both TCM and Ayurveda, they seem to have a bias against raw foods.
Yes, Ayurveda especially, does not very much in favor of raw foods.
Yes.
I think if you have a balance of fruits and vegetables, and you just lightly cook your vegetables, like just quick stir fry them without cooking them to extinction, like the Indians love to do.
Yes.
And then that's okay, you can do that. The grains are a bit of a problem for us Asians because we don't digest wheat as well. Our rice is the preferred.
Yes.
And milk with the mucus with our Asians, lacking the lactase enzyme is not such a good idea. So you can get into soya milk, for example. And protein, lean meat, protein, fish or chicken, stuff like that is all right. But processed meats are not a good thing to have.
Okay.
Then evening I cook a meal for myself, either some stir-fried vegetables, or I cook Thai food or Chinese food or Asian type of food, or maybe once a week I have a roast, which I think cook. And then in the evening I usually go for a walk for about 45 minutes. I walk about 4 to 5 kilometers every day.
Wonderful.
Yeah, then come back, and then after you prepare your meal, you watch a bit of news, and then I usually meditate a half an hour before I go to sleep. And then I go to bed about 9:30, 10, and I'm up again at 7, and that suits me. That's good enough for me.
Wow, that is very disciplined. The two bookends of meditation.
Yeah, it's very important.
Yeah.
You should. I mean, that part, it's not, each person will have to find the time to do whatever they can.
Yeah.
But if you balance some kind of between activity and rest, talking about the mind, the mind has to be active for us to function in our occupations and our life during our working day. But the mind also needs to be allowed to rest.
Yes.
And a lot of sleep disturbance is caused by an overactive mind, right? So
yes, absolutely.
Yeah, that's it. A very simple routine.
Yeah. I like how spacious it is. I think this is the main problem, like you said, if we actually allow ourselves to rest, your body has its own wisdom and knows what to do.
Yes.
But the brain, sometimes the mind can be a tyrant. Sometimes you have the tyranny of the mind, and it's like all the other four aspects of self, the body, the emotions, the spirit, it all becomes bullied by the mind.
The mind drives you.
Yeah, absolutely.
Yeah.
That's why my therapist Volker always said something like the mind is a lousy master but a good slave.
Exactly. You have to train the mind.
Yes.
You've got to use it as an instrument.
Yes.
For the bigger sense of self that you are. Otherwise, the ego just runs wild and creates a lot of conflict.
Yes.
This me stuff. There's no end to it. And it creates a lot of trouble for all of us. being aware throughout the day of what am I thinking, what am I feeling, why am I doing this? If I have a negative thought, why am I holding this negative thought? I can let it go.
Yeah.
It's not in charge of me. I'm generating this thing. I can change this.
Yeah.
So you shift the focus of loss of control back into a sense of self that
Yes.
I am, and I can decide what I
Yes.
want to think. I can decide what I want to feel. I can decide how to behave, what I want to eat, what I want to drink, stuff like that.
Yes. I
Yeah.
can shape my destiny.
Yeah, exactly.
Yes, wonderful. Well, this has been a wonderful conversation. I honestly could speak for 2 hours.
Yes. No, I've thoroughly enjoyed it. I really enjoyed the exchange. And
I want to ask if is there anything else you want to share about your book?
no, the book is that we've been through all what is in the book is basically what we've been talking about, the
Yes.
physical, emotional, mental. Each of these has a chapter of itself.
Yes.
And there's a chapter on cancer, which is the specific interest I had. And,
Oh yes. You have,
if we want to summarize, my whole person model can be summarized in 8 words. Eat well, move more, stress less, and love more. If you just apply these 4 principles, simply just eat properly, exercise, move your body, manage your stress, and love more, that's all you need to do. That's your whole person model.
it's simple but not easy for sure.
Not easy, but we can try. We
Yes.
must encourage our people to try.
Yes.
Yes.
Well, thank you so much for joining us today. Where can we find your book?
We can find my book on my website, www.drhirasingh.com.
We'll put the link, in the notes.
That's it.
Yes,
Yeah.
wonderful.
Great. Thanks for having me.
It's a
I
pleasure.
really enjoyed it.
Yeah, me too.
Thank you.
Thanks for joining us on Comfort and Growth, the podcast for people who are passionate about personal growth and productivity. This has been a fabulous podcast with Dr. Hira Singh. And if you're interested in checking out his book, Healing the Whole Person, I highly recommend it. It's a really nice, practical read, and you can check out his website and order his book. So we'll drop the links to Dr. Hira's book and his website in the show notes below. Until next week, thank you so much for watching Comfort and Growth. We are so delighted to have you. And please like, share, and subscribe about our podcast. Bye. See you.